Welcome back to Insight. I'm here with Dr. Sequila Liebetrau from the Bowen Center. Well, unfortunately, it's about that time of year when it's, chilly, and it gets even chillier, and we feel like we see the sun once every 3 months. So it's time for that time where we get that seasonal depression because it's just gross outside. What can we do about that? It's a real thing, isn't it? I'm not just making that up.
You're not making it up. So seasonal affective disorder, also known as SAD, is a condition that is a mood disorder. It's cyclic in nature. So we tend to see the depressive symptoms increasing either in the fall or including fall and winter, and then we see mood improving in the spring and in the summer. So what can we do, you ask?
Please help, please, I'm begging you.
There absolutely are interventions. So first off, light therapy is very effective. That's where you purchase a special light box, and the instructions is typically to get exposure to the light box early in the morning for about 20 to 30 minutes. You want to have direct exposure to it, but you don't want to look directly into the light. Obviously, you don't want to damage your eyes.
Yes, not good for the eyes.
So, in addition to that, it would also be helpful to increase your exposure to natural light. So, making sure that your curtains are open, making sure that you get outside to get as much natural light as possible. If you combine that with exercise outside, even better, because of course exercise increases serotonin levels, and with seasonal affective disorder, we know that serotonin levels are actually decreased, melatonin levels are increased, and so if you exercise, that helps with that as well. In addition to that, making sure that you work on negative thinking patterns that can contribute to negative mood, making sure that you don't avoid going places and doing things.
That's the worst, because don't you just feel like I do? I just want to hole up in the winter. Thank heavens basketball season happens during the winter, or I might never leave my house.
Yes, so you don't want to do that. You definitely want to schedule activities, especially if you know that you tend to get depressed during the winter. You want to make sure that you schedule things to get out and about and be with others.
So if we are suffering from this and we don't feel like, we're trying the exercise, we've tried the light or tried getting outside and just can't get over that hump, Can we come see you guys at the Bowen Center?
Absolutely.
Therapy
is very helpful. Medication management might be necessary, especially if your symptoms are more severe. So we're definitely there for you to help and support you.
And what does it take? Is it just a matter of making a phone call to schedule an appointment?
Absolutely. That's all it takes.
It's that easy. All you have to do is call and schedule that appointment.
All you have to do is call.
And does it take two? I think people wonder, if I feeling kind of down and I think, well, maybe therapy would help. Is it a long-term commitment? And am I going to have to come once a week for a year to get results? Can I come a few times? How does that work?
You know what? The good thing about therapy is that we work with you. It's a collaborative effort. We come up with a treatment plan to decide what would work best for you, and then we set the goals. So if you really want to do quick in and out and your symptom presentation is such that we think we can do it, then that's what we're going to do. If your symptoms are maybe a little bit more severe, we may have to take a little bit of a longer approach, but absolutely we can work with you to make sure that it fits with your schedule and that it meets your needs. If you're the client, you have to be happy.
And that's what it's all about. We want to help make you happy, and the season doesn't have to dictate whether or not you're happy. No. Give them a call today at Bowen Center. Check out their website, bowencenter.org. We'll be right back.